Welcome back to Diabetic Foot Files. So, when it comes to diabetes and wound care, yes, wound care specialists, and we're all about healing wounds and closing them and keeping the limb. But I think sometimes we forget that diabetes is a pretty much whole monster in itself. It doesn't just affect the foot. Like we said, it usually manifests itself a lot in the foot at first, like the numbness, tingling, or a possible ulcer. But when it gets to that point, the diabetes is quite advanced once the diabetic foot ulcer appears. And that's something that we sometimes lose sight of because we're just focused on the ulcer instead of the whole picture, the entirety of it, that there are cardiac problems, cardiovascular problems, the diabetic autonomic neuropathy. And I remember learning about it in boards. They were talking about diabetic autonomic neuropathy, and the lady was explaining about her family relative who passed because of a silent MI, and she was explaining that they can't feel it because with heart attacks, because my father even had one, they feel it. They feel the chest pain, you know, things like that. And with diabetic autonomic neuropathy, we think numbness and we're just thinking of numb feet, but they actually have numbness in their cardiac nerves as well. So that's something that we also have to really put a red flag on and keep a good eye on. That's why vascular still is so incredibly important. Vascular should be the center of any diabetic patient's medical care to make sure that everything is fine and it's ruled out, and to make sure that there's no clots, blood pressure is managed, all this jazz. Because I think we always just think of sugar and feet when we think of diabetes, and rarely we think of the heart. And that's a big part of diabetes as well. So, when people think of diabetic neuropathy, they just think that it's the numbness of your feet. And it's not just that, it's the loss of sensation, it's the loss of the burning. The loss of sensation is that burning pain, that pins and needles. But also, there's another form of nerve damage that is far more dangerous, and that's diabetic autonomic neuropathy. And this type of diabetic autonomic neuropathy, does not affect the skin. It actually affects the nerves that control life itself. So we're talking about the nerves that affect the heart rate, the nerves that affect the blood pressure, the nerves that affect digestion, the nerves that affect sweating and bladder control. Because one thing I did know is that diabetic autonomic neuropathy affected the sweat glands, right? And that's why they get really dry feet and the cracks and the fissures because it affects the sweat glands. But it actually also affects the nerves in your heart. So even the nerves that warn the brain that the heart is having problems, like the heart is possibly dying, those are numbed, okay, or dulled out. So this condition is called diabetic autonomic neuropathy, and it actually is one of the most devastating complications of type 2 diabetes. And unfortunately, I believe I've lost a patient or two to that, and it's quite devastating. So for clinicians who treat diabetic foot disease, this condition explains something many of us experience. And thank God for my mentors. Like I said, they are amazing. They're well versed in this field. I just go straight to them, my mentors, and they explain what happened. And patients may survive the wound care and the wound might heal, right? Finally, like you're so happy of this feat. The marathon is over, that the wound is healed, right? But then they possibly pass away. So we're gonna dive deep into how diabetic autonomic neuropathy develops, the molecular biology behind it, how it affects the heart, the gut, the bladder, the sweat glands, how it contributes to silent heart attacks, how clinicians can detect it, and what the latest research says on about how we can prevent this from happening. So, the autonomic nervous system. So, the autonomic nervous system is the body's autopilot. So, you see automatic, right? Autonomic nervous system, autopilot. It controls the functions that occur without conscious thought. So, these are like our heart rate, our blood pressure, our digestion, our breathing, our sweating, our pupil dilations, our bladder emptying. And there are two major branches of the autonomic nervous system. There's the sympathetic nervous system, which is fight or flight system. So that increases your heart rate, blood pressure, and alertness. There's the parasympathetic nervous system, which is our rest and digest system. So that slows down your heart rate. It slows metabolism. It slows gastrointestinal activity. And together, these systems help maintain the homeostasis of the body, right? But in diabetes can destroy these nerves that help regulate them. So, diabetic autonomic neuropathy occurs when there is a chronic hyperglycemia that damages the autonomic nerve fibers. And over time, these nerves degenerate. The organs they control begin to malfunction, and this can affect multiple systems particularly the cardiovascular system. So it protects the resting. It can cause resting tachycardia, orthostatic hypertension, and silent myocardial infarction. When it comes to the gastrointestinal system, it can cause gastroparesis, delayed gastric emptying, nausea, bloating. Then in the genital urinary region, it can cause bladder dysfunction, urinary retention, and erectile dysfunction, unfortunately. And the pseudomotor dysfunction, such as abnormal sweating, dry skin, and heat intolerance. So let's go into the different biochemical pathways that cause di- diabetic autonomic neuropathy, how diabetes damages these nerves. So the main culprit, what we say, is the chronic hyperglycemia. So when glucose levels remain high, and that's why it's so important to test your blood sugar because that tells us how well your body is doing, how well your body is doing underneath the stress. Because the better control the blood sugar is, right? The better control your body can function in a normal fashion. But when it's too high, the body is malfunctioning, is haywire, okay? So when the glucose levels remain elevated, the nerve cells become overloaded with glucose. And unlike other cells, neurons cannot regulate glucose uptake effectively, and this causes metabolic stress. Then another pathway is the polyol pathway. I'm going to spell that Polyol. Polyol pathway activation. So excess glucose is converted into something called sorbitol. I've learned, sorbitol is look at those sugar-free candies. They have a lot of sugar, sorbitol in it. Sorbitol accumulates inside nerve cells. This can cause osmotic swelling, oxidative stress, and nerve injury. I don't like sorbitol at all. It makes me feel sick. I don't like it. Now, we all know that diabetes causes advanced glycation end products. So glucose molecules bind to the proteins, forming advanced glycation end products, AGEs. And these compounds damage structural proteins, stiffen the blood vessels, and trigger inflammation. And advanced glycation end products also damage the microvascular that supplies the nerves. Then the oxidative stress. So the high glucose increases the production of reactive oxygen species. And these molecules damage the mitochondrial DNA, the nerve membranes, and the proteins essential for nerve signaling. Next is microvascular ischemia. That's something that majority of diabetics have to deal with. These tiny blood vessels supplying the nerves develop endothelial dysfunction, thicken basement membranes, and reduce blood flow. And without oxygen and nutrients, the nerve fibers begin to degenerate. So, let's dive a little bit more deeper into the dangerous one, the most dangerous form of autonomic neuropathy, and that's cardiovascular autonomic neuropathy. So, one of the most dangerous forms of autonomic neuropathy is the one that affects the heart, cardiovascular autonomic neuropathy. And it disrupts the nerves that regulate the heart rhythm. So, the effects include resting tachycardia. So, the heart rate remains elevated even at rest, reduce heart rate variability. So healthy hearts adjust rhythm constantly. In autonomic neuropathy, this variability disappears. So this is an increased marker of mortality risk. Orthostatic hypertension. So when you stand up, the blood pressure suddenly drops. And symptoms include dizziness, fainting, blurred vision. Next is the one that I hate is silent heart attacks. So it damages the cardiac sensory nerves, means the brain never receives the pain signals that something is going wrong. So a silent myocardial infarction is a heart attack that occurs without typical chest pain or dramatic symptoms. The heart muscles are still deprived of oxygen and the tissue damage still occurs, but the brain never receives a strong pain signal. And this particularly is quite common in type 2 diabetes. And studies suggest up to one third of heart attacks in diabetics are silent. So, what happens in a silent MI? Coronary artery disease develops. So, diabetics, they have the atherosclerosis, right? The plaque buildup and that are inside the coronary arteries. And high blood sugar causes endothelial injury, inflammation, and plaque formation. So eventually, the coronary arteries become narrowed and they can develop and manifest as coronary artery disease. Plaque rupture and clot formation. So a plaque may rupture and the platelets rush in to form a clot. And then the blood flow suddenly stops and this causes a myocardial infarction. Also, there's the risk of the heart muscle becoming ischemic. So, without oxygen, cardiac cells switch to anaerobic metabolism. So, within minutes, lactic acid accumulates, cell membranes break down, calcium overloads occur, and the cardiac muscles begin to die. Normally, this would cause severe pain, but in diabetic, the signals may be muted. And that's why it's such a red flag when you see your patient with a horrible raging infection and no pain. Imagine what's going on inside their body, the other organs that possibly are in dysfunction, and they can't feel the pain that is a warning signal. So, the key reason why there's about one third of diabetics that do not feel a heart attack is the damage to the autonomic nervous system. Okay, so over time, the high blood sugar damages the nerves that control our internal organs, and these nerves transmit pain signals to the heart from the heart to the brain. So, what other symptoms may occur instead? So, without chest pain, subtle symptoms like sudden fatigue, shortness of breath, nausea, dizziness, sweating, ingestion like discomfort. Some patients only feel extreme tiredness, others may feel nothing at all. So that's why it's so important to go to vascular. So how do silent heart attacks, how are they diagnosed? Doctors usually detect them through an echocardiogram. An echocardiogram may show evidence of a previous heart attack, such as abnormal Q waves. Also, we have something called cardiac biomarkers. So blood tests detect proteins released by injured heart muscles. The most important is troponin, okay? And elevated troponin usually indicates cardiac muscle injury. Then imaging, they can use a echocardiography, cardiac M, a cardiac MRI, and then a coronary CT. Okay, these also reveal damaged heart muscles. So, autonomic diabetic autonomic neuropathy increases the risk of lethal arrhythmia. So the heart rate is not right, and the most dangerous one is the ventricular fibrillation. During ventricular fibrillation, the heart muscle stops pumping effectively. Remember where the ventricles are there at the bottom, right? There's chambers, the atriums and the ventricles, right? And the blood flow to the brain stops and the loss of consciousness occurs within seconds. And this condition is associated with sudden cardiac death because the autonomic nerves regulate the heart rhythm and their damage increases susceptibility to these type of events. With the gastroparesis, the stomach will empty too slowly, and that could cause bloatiness. Another thing with autonomic neuropathy that I don't think people really talk about is the bladder dysfunction and the sexual dysfunction that occurs. So, incomplete bladder, emptying urinary retention, recurrent UTI, so recurrent urinary tract infections, and like we said, erectile dysfunction that could happen with men who have diabetic autonomic neuropathy. And, for women, they could have something like decreased lubrication or painful intercourse. Okay. So these are all things that need to be address. Like we said, diabetes is not just a one thing. Like I think it's because we don't get to see exactly what's going inside of the body. We just think it's you take your meds for the glucose and then you live your life, you wear the shoes, you make sure you don't get an ulcer, but we're not thinking about every single thing that affects it. It's a metabolic disease, okay? And our metabolism is what keeps us alive, okay? So diabetes is a metabolic dysfunctional disease, okay? So another thing, we talked about the sweat dysfunction, the excessive sweating or lack of sweatiness in their feet. That could happen with the sweat glands in autonomic neuropathy. That's why I said they are prone to having dry skin and fissure, and that's why you need a diabetic lotion. So, how do you diagnose diabetic autoneuropathy? What I would do, I would refer them to neurology for them to do the testing. But there are several tests that can detect autonomic dysfunction, such as heart rate variability testing. So, this measures the changes in the heart rate during breathing. So, loss of any of that variability suggests autonomic damage. There's another test called the tilt table test. So, that evaluates the blood pressure changing when standing, used to diagnose orthostatic hypertension. Next is the sweat testing that evaluates the pseudomotor function. Gastric emptying studies used to diagnose gastroparesis. So, how do we prevent this? Most effective strategy is tight glucose control, and I hope people hear that. That's why it's so important for us to control your glucose. That's not us saying you can't eat, you can't have fun or anything like that. It's because it plays such a huge role in the progression of the disease and that it can cause more dysfunction in all the systems in your body, and we don't want that. So one of the strategies are when it comes to cardiovascular management, that's why you need to see your vascular doctor. Blood pressure control, cholesterol management. Next is exercise. A lot of diabetics and vascular usually put patients, even the patient who has poor blood flow, on walking programs, assigned walking programs. And we'll have a special guest talking about that for us. But that's why it's so important to see vascular. Diabetes, you need to see vascular. No matter what, if you have diabetes, see your vascular doctor. Have an assigned vascular doctor. And if you're cleared, see them once a year, okay? And if anything comes about or anything, see them sooner, okay? But you have to remember, diabetes affects the vascular health of the patients, okay? So why does this matter to us as wound care specialists? I already told you my story, but patients with diabetic foot ulcers often have severe autonomic neuropathy. And this explains the poor circulation, the abnormal sweating, the increased infection risk, and it also explains why some patients develop silent cardiac events and why the diabetic foot ulcer is a visible sign of an invisible systemic disease. So, what does the latest research show? It shows that silent heart attacks are more common than previously believed in diabetics. Many have discovered it incidentally during imaging tests. That's why it's so good to follow up. Like we said, multidisciplinary approach. Patients with silent MIs have a similar mortality rate to symptomatic heart attacks. And like we said, autonomic neuropathy significantly increases the risk of a sudden heart cardiac death, unfortunately. So it shows that there should be growing interest in screening high risk diabetic patients with cardiovascular disease earlier. So, in the end, diabetic autonomic neuropathy is not just a nerve disorder. Stop thinking it's just numbing your feet, numbing your hands, tingling pins and needles. It's a condition that affects the body's most fundamental control system, the heart, the stomach, the bladder, the blood vessels. And sometimes the first sign is not obvious. Sometimes the first sign, unfortunately, could be sudden death. So that's why it's so important for us to understand autonomic neuropathy is critical for every clinician who is treating patients with diabetes. So this is Diabetic Foot Files. I hope everybody enjoyed this episode and I hope it sticks with everybody because I mean when the patient is not able to follow up or be managed properly with vascular and like we said, we always need vascular, especially with a diabetic patient. The diabetic ulcer is just a sign, a symptom of something greater going on in the body because of diabetes. And I hope everybody remember that because I think all my patients are incredible advocates for themselves, incredible fighters, and I want their legacy to live on, and one of my patients, I know for sure she will. So this is Diabetic Foot Files, and I'm Dr. G, and take care of your feet and your heart because they take care of you.